If there is anyone out there who still doubts that America is a place where all things are possible, who still wonders if the dream of our founders is alive in our time, I will make certain that every single American in this country has health care that they can count on. And I won't do it 20 years from now. I won't do it 10 years from now. I will do it by the end of my first term as President of the United States of America.
So Obama's platform on health care was kind of a vision more than a specific set of promises. It was a vision of moving to a healthcare system that covered more people, that did more to improve quality, that did more to control costs.
I think there are problems with this. If you actually look at his proposal, there would in fact be big changes for lots of people who currently have coverage.
The Clinton administration, of course, wanted to go ahead with this massive plan, and they laid out a very, very structured plan with lots and lots of elements to it. I think in many ways you could see the Obama plan as almost a reaction to that. He really didn't want to do that.
Americans are very resistant to big changes in their health care. I think if you look at what might actually succeed, laying out to the American people where we actually want to go and drawing them into the conversation, explaining it, and then saying we're going to do this in stages and steps. I think Americans are much more likely to accept that.
The most important thing that President-elect Obama has to do right away is build an infrastructure to build the healthcare reform on. You know, the financial crisis will certainly impact the debate on healthcare, and it will have to do that in many different ways. One of the ways that it will is that the government is going to be looking for money, and that's going to make them reluctant, I think, to probably do a big healthcare expansion. On the other hand, there will be all these people losing their jobs and losing their employer-sponsored health insurance, so that part of the crisis is going to get worse. And that's going to lead to some impetus to actually do something for those people. And on the other hand, we're going to be rethinking how we structure our economy all around. The move towards deregulation is probably over. We're going to be thinking about how can the government effectively use its regulatory power. And that may also change how the debate on healthcare works.
Is he going to build on what we already know? If he starts to do that, I think he's going to be much more successful and he's going to have a lot more support.
Cries of government involvement and, you know, this is going to be run as badly as the post office if the government takes it over, could be replaced by this is going to be run as badly as Lehman Brothers if the government fails to take it over.